Jakarta, the epicenter of the outbreak, has suspended all religious gatherings for 2 weeks, including a rally of Muslim pilgrims that drew thousands of people from across Asia on Wednesday.
Well, earlier, organizers had rejected a formal request from authorities to postpone the gathering, stating that they were more afraid of God than the virus. Now, an estimated 8,600 people already assembled in Goa.
But Indonesia's top Muslim clerical body said that Mass Friday prayer remains mandatory for people in areas with low potential of contagion, also called green zones.
All right, for more, let's bring in our correspondent, Saiful Ismail, joining us from Jakarta. So, Saiful, despite official efforts to suspend mass gatherings, looks like Friday mass prayers are still on following that decision made by the Indonesian Council. Tell us more.
Well, that's right, Julie. Friday prayers can still continue, and Muslims can still go to the mosques and do their congregational prayers. However, the Indonesia Ulama Council, which is the country's top clerical body, has said that Muslims in areas less affected by COVID-19 could perform the Friday prayers at mosques. But people are encouraged to minimize physical contact, bring their own prayer mats, and wash their hands diligently. But Friday prayers in Jakarta has been suspended for 2 weeks after the city's governor Anies Baswedan made the call, saying that the capital has become an epicenter for the virus in Indonesia. Now, in addition, the council had earlier issued an edict on compulsory Muslim prayers, especially during the COVID-19 pandemic. The council said Muslims in areas where the virus had spread uncontrollably, it is not permitted to perform Friday prayers in the mosques until the situation returns to normal. The council added that it is forbidden to hold religious activities that involve large numbers of people that could further spread the virus. Muslims are, however, obliged to replace Friday prayers with the noon prayers at home. Now, the call to suspend Friday prayers has been largely heeded by Muslims in Jakarta. The Istiqlal mosques in central Jakarta, which is the biggest mosque in Southeast Asia, has said that it will suspend Friday prayers and other congregational prayers. However, the mosque will not be closed. It will still be open for worshippers to come and do individual prayers. But the move to suspend Friday prayers will be a challenge because this congregational prayer is not only done at the mosque, it can also be done at other places like multi-story car parks and inside buildings, as long as there is a minimum of 40 people. So this suspension of congregational prayers not only needs the cooperation of mosques, but also many other parties, and most importantly, the Muslim community themselves.
Yeah, exactly. The right thing to do, Saif, will be to pray at home. Listen, moving on, the government says that they're preparing for massive screenings of COVID-19. How complicated will this be? How will they get this done, given, of course, how fragmented Indonesia is with so many islands, and then, of course, the issue of getting enough test kits?
That's right, Adam. It is a big challenge for Indonesia, which is the largest archipelagic nation in the world. The state-owned enterprises ministry said that the first batch of rapid COVID-19 test kits from China have arrived in Indonesia. However, the ministry did not reveal how many of the test kits have been received. Now, state-owned diversified manufacturer PT Rajawali Nusantara Indonesia said the health ministry has given it permission to import the rapid test kits. An order for 500,000 kits has been placed. Now, these kits, which meet World Health Organization standards, will arrive in Indonesia in batches. Now, the new kits can provide results quickly for early detection in less than 3 hours. The regular test usually takes a few days for the results to be determined. Now, authorities realized that more and more people are aware of the dire situation in Indonesia and want to be tested for COVID-19, but not everyone will be able to take the rapid test. Priority will be given to those who have come into contact with a confirmed COVID-19 patient. Now, to anticipate a rise in confirmed cases, the government has also called for hospitals to set up health protocols for handling those who had performed the test. Hospitals must determine who can isolate themselves at home and who requires advanced treatment in hospitals.